I've been asked to talk about impotence. Impotence is a failure in the man to achieve an erection sufficient for sexual intercourse. Women, fortunately for themselves, don't have to worry about that, but men do. Impotence probably has many causes. It could be toxic, it could be hormonal, and it can be circulatory. Today, the treatment of impotence in men centers around a drug called Viagra. And yes, Viagra works. There's no doubt about it. It does have problems, though, and it's not really addressing the cause. We're seeing today in men, in my opinion, an epidemic of hormone dysfunction. Testosterone levels are declining. And in fact, low testosterone levels are a major cause of heart disease. One of the biggest risk factors for heart disease, predictive risk factors, is a man who cannot get an erection. That man could be headed for heart disease because testosterone levels are very important for the function of the heart. Testosterone itself raises the production of nitric oxide. Nitric oxide is a vasodilator, which is important for heart function and blood supply to the penis for filling, for erection. Low levels of testosterone can lead to low libido and low nitric oxide. Other circulation problems. We have an epidemic of circulation problems in this country in both men and women, not just in the coronary disease and the carotids, which go to the brain, but also if it can be in the heart or if it can be in the carotid artery, it can be in the pelvis and reduce blood circulation to the penis. Treatments for that would include cleaning up the body and addressing all of the factors I spoke about earlier, such as chelation therapy, oxidation therapy, and anything we can do to improve the circulation. There are many herbs that can be used as an alternative to Viagra. Royal maca is one, yohimbe is another. It depends upon the individual which one I might choose. Zinc is deficient in many men, and zinc is essential for normal testicular function, testosterone production, and sperm production. We should be checking zinc levels in patients and also making sure they're not toxic with cadmium, which interferes with zinc, or other heavy metals. There are other ways to treat impotence. I find that the psychological aspect is a major factor. Since Viagra came out, that's been downplayed. They started saying that it's all physiologic, but I know many men who take a small amount of Viagra and they can get an erection and perform sexually, and after they do that for 2 or 3 times, they don't need the Viagra again. What does that say? That says that something happened to the man that caused a fear, an anxiety, or a psychological disturbance that did cause a physiologic dysfunction. When the man took the Viagra and was able to achieve an erection and perform for a couple times, the fear then was gone and he was able to function normally afterwards. I think there's a wonderful case for the use of Viagra for this because it has helped a lot of men recover normal sexual function and they didn't need the Viagra anymore. But surely the psychological aspects have to be looked at, and a good partnership between a man and a woman is absolutely essential. There has to be love on both sides. The woman needs to be very loving, understanding, and sensitive to the man, as the man has to be to the woman. I'll also add that simply because one or both partners cannot perform sexually for sexual intercourse, in my opinion, is not a reasonable excuse for not maintaining sexual intimacy, because there are many other ways to maintain sexual intimacy and the wonderful male-female contact besides sexual intercourse.